My husband and I were sitting on the couch. It was like 6:40-ish in the morning. All of a sudden he said I just started like shaking.
I looked over to the right at her and looked like she was seizing. And so I started performing CPR on my wife on the back living room couch at 6:45 in the morning.
The paramedics, I didn't have a shockable heart rate at the time of arrival, so they had to do CPR. And finally, when I gained a heart rate, they were able to shock it. And then they put me on the stretcher. And when I got wheeled out into the ambulance, I lost it again. So then they shocked it again in the ambulance. And then when I got to the hospital, I lost it again coming through the doors of the ED.
You know, I heard yell clear, and I'm just like, oh my God, oh my God, oh my God. You know, but she's in the best possible care.
Once those patients have a return of spontaneous circulation in the field or at home with the paramedics, we initiate hypothermia protocols. We initiate those by starting to cool our patients. Research has shown that with hypothermia or with cooling techniques, we can increase the neurologic outcomes of the patients that do survive to hospital discharge. We worked heavily with the emergency department and the team that was there on maintaining return of spontaneous circulation. We recognized through collaboration with all three of those specialties that this was a critical need. And that's really where the development and the idea of the Resuscitation Center took hold.
I suffered about 7 months of memory loss. So the doctors say it's completely normal to lose memory. They say it was about 11 minutes without oxygen to your brain, which accounts for the memory loss. And then they said if I was going to get it back, I would have gotten it back by December of this past year. So I guess it's pretty much gone.
Once the patient has come into the ICU and we've received them from the ED, we are immediately beginning or continuing the hypothermia process. We ideally would like to get the person down to goal temperature, which is 32 to 33 degrees Celsius at within a 4-hour period. The quicker the better for getting the patient as chilled as we can. The Arctic Sun machine is what we use to chill the patient, and it comes with large gel-filled pads that circulate water through them. We apply these pads to their trunk that comes around the back, meets in the, there are 4 pads, 2 on the trunk and 2 on the thigh. And they wrap around, covering the majority of the torso and the thighs. And now you can imagine that with the chilled water going through those at this, maintaining this temperature of 32 to 33 degrees, we need to be very careful with skin and monitoring of that. These patients are 1-to-1 patients, meaning one nurse to the patient, so it's one-on-one. But in the beginning, it's a whole team trying to get this patient set up as quickly as possible.
You know, because it was a new thing, the Arctic Sun was new. And so I was only one of the first few people that ever got to use it.
There is the occasion that we would receive a patient from the cath lab if they had gone from the ED to the cath lab due to an cardiac arrest. Their EKG showed ST elevation, so they would then immediately take them to the cath lab and then come to the ICU. One of the challenges with the hypothermia is, you can imagine the shivering that while we're pulling them down, their temperature down, it's a normal process to shiver. So we do manage even that with some paralytic agents. We also try and manage any pain, and we are using sedation medication. The temperature probes, again, that we're monitoring the core temperature through are the Foley catheter, which is a special catheter that has a temp probe at the end of it that we use as our primary source of measuring the temperature. Now, we also have to have a secondary backup, as in everything. We want to make sure we're double checking our systems, and that secondary is the esophageal probe, which literally is laying right up on, we put it right next to that ET tube, and right back basically on top of the balloon is where it's laying. Throughout the whole 24-hour process of once we get to goal temperature, 32 to 33 degrees, we maintain that 32 to 33 degrees for a 24-hour period. At the point of that 24 hours being chilled, then we would start the rewarming process. The rewarming process through the Arctic sun is a slow process. We try and rewarm the patient at a minimum of within an 8-hour period. Ideally, we would like it to be maybe 10 or 12 hours.
I did. I met the paramedics. I went and saw them, drove up there, and from the time I opened the door, those people knew exactly who I was and remembered my story like it was yesterday. And the paramedic who made the decision to shock me that third time had said the last we had known was that I had a viable heart rate at the time they left the hospital. Now, they didn't know if I kept it, if I had to be shocked again. They didn't know anything else, if I ever survived. They just knew at the time that they had left, I was alive. Not in great shape, but I was alive. And I got to talk to them and share their stories and see the inside of the ambulance, and they showed me the tubes that they used, and the paramedic that was working on me while we were driving was saying that they was driving so fast, and I said, how do you do this when, and he said, oh, it was easy because I was just laying there so still that, he could start the IVs and do the tubing and, but it was just a story that, you think, gosh, those are the people, first responders, that can tell you from prior to getting to the ER what had happened.
I think probably one of the best things that have come out of this program is I think the general community or layperson's idea of cardiac arrest is something like what they see on ER, and the expectations are that they see over a 70% chance of survival when you watch television or movies, and the reality is that that's not true. But with the focused collaboration of the different teams, we're edging ever closer to those types of survival rates. And what it gives back to the families, what it gives back to the community, in the sense of folks that are neurologically intact that can go back to work or back to enjoy their retirement or back just to give their children a hug, has been the biggest benefit that we've recognized.